Hello, everyone, and welcome to week 2. Last week, we introduced the foundations of clinical assessment and discussed the role assessment plays in counseling practice. This week, we are going to explore a concept that sits at the heart of responsible assessment practice, psychometrics, or the science of psychological measurement. While psychometrics often involves statistical language that may initially feel unfamiliar, it plays a crucial role in helping counselors determine whether an assessment tool is trustworthy, meaningful, and appropriate for the clients we serve. One of the most important concepts in psychometrics is reliability. Reliability refers to the consistency of an assessment instrument. In other words, if the same individual takes the same assessment under similar conditions, we would expect the results to be relatively stable. Reliability can be examined in several ways. For example, test and retest reliability evaluates whether scores remain consistent over time. Inter-rater reliability examines whether different evaluators arrive at similar conclusions when scoring the same assessment. And internal consistency evaluates whether items on the test are measuring the same underlying construct. Reliability is important because if an assessment tool produces inconsistent results, it becomes more difficult to draw a meaningful conclusion from the scores. Imagine using a thermometer that gives a different temperature every time you check it. It would be difficult to trust the reading. The same principle applies to psychological assessments. However, reliability alone is not enough. An assessment must also demonstrate validity. Validity refers to whether a test actually measures what it claims to measure. For example, if an assessment is designed to measure anxiety, we want to ensure that it is truly capturing symptoms of anxiety rather than something else, such as general stress or fatigue. There are several types of validity that researchers examine. Content validity considers whether the test items adequately represent the concepts being measured. Construct validity examines whether the assessment accurately captures the psychological construct it intends to measure. And criterion-related validity evaluates whether test scores correlate with other relevant measures or outcomes. In addition to reliability and validity, counselors also need to understand a few basic statistical concepts that appear in assessment reports. For example, scales of measurement, nominal, ordinal, interval, and ratio help determine how data can be interpreted and analyzed. We also look at measures of central tendency, including the mean, median, and mode, which helps summarize typical scores with a dataset. Another concept you may encounter is standard deviation, which tells us how spread out scores are around the average. When we combine these concepts with norm reference data, we can begin to understand how a client's score compares to a larger reference population. Many psychological assessments are designed using what is known as normal distribution, often represented by the familiar bell-shaped curve. This allows counselors to interpret where a client's score falls relative to others within the norm group. As counselors, we do not necessarily need to conduct complex statistical analyses ourselves. However, we do need to understand enough about psychometrics to evaluate the strengths and limitations of the assessment tools we use. This knowledge allows us to make thoughtful decisions about whether a particular instrument is appropriate for a specific client or clinical situation. As you move through this week's readings and activities, I encourage you to think about a psychometrics as a foundation for ethical and responsible assessment practice. Understanding these concepts will help you become a more critical consumer of assessment tools and ultimately support more accurate and meaningful interpretations of assessment results.